Hi, I'm Dr. Ken Winnard, founder and Chief Medical Officer of OneLife Health and Performance. Before beginning this video, I would like to congratulate you on taking this step towards bettering your health. In this video, we are going to go over what to do when you receive your medication, where to store your medication, the two types of injections you may be asked to perform at home on your own, and how to properly dispose of the materials used in your injections. First, let's begin with the unboxing process. You will receive a box from any number of compounding pharmacies that we work with. Keep in mind that we may order your medications from different pharmacies, so you may receive several different boxes. Begin by removing all medications. You should check each plastic prescription bottle that the medication comes in for your name, the name of the medication prescribed to you, and that the expiration date is appropriate. Additionally, if there is a vial in the plastic bottle, remove it and check the vial for the name of the medication and an appropriate expiration date. If any of this information is incorrect, contact our clinic immediately. You may also notice that the bottle may have different dosing information on its label than what was given to you by your provider. Be sure to always follow the dosing recommendations given by your provider. This can be found on your medication information sheet provided to you by your patient advocate. Remember, this dose was created specifically for you to make you feel your best. You may find that your medication containers look different from each other. Here are some of the different containers that you might encounter. For injections, you will receive any number of needles and syringes that look something like this or something like this. Simply set them aside until you're ready to do your injections. You can also find instructions for which needles to use for each injection on your medication information sheet. One type of medication you may receive is a cream. It comes in a container that looks like this. This is called a toppy click. You use it by removing the lid and rotating the bottom. This makes a clicking noise and dispenses the cream on top. You then use this as an applicator to rub the cream onto your skin. The number of clicks you should use to dispense the medication is located on the bottle or on your medication information sheet. The cream should be applied to clean, dry, and intact skin only. It is very important that you know that it is possible for you to transfer this medication from the skin to other individuals or pets. This can cause harm. To best help you avoid transferring medication, we recommend using the front or inner thigh for application, as this area is not too often exposed to others. However, you can also apply cream to your forearm or upper arm. Just make sure to use caution when using these sites. If you decide to use your hands to apply the medication, wear gloves and dispose of them immediately after application. Cream should be stored in a cool, dry place. They do not need to be refrigerated. Another type of medication you may receive is a troche. It will come in a tray like this. Here you can see the medication. Troches should be placed in the mouth between the cheek and gums. The medication will then dissolve slowly and be absorbed through the buccal membrane. We call this sublingual absorption. Be sure not to chew or swallow the troche whole, as it is not designed to be absorbed this way. Store this medication in a cool, dry place such as a cabinet or in your refrigerator. This is a personal preference and both options are okay. Just be careful not to leave your troches in the heat, as they can melt. You may also receive supplements for our clinic. These supplements do not need to be refrigerated and are best stored in an area where you will see them often and remember to take them. Tablets and capsules are also prescribed often in our clinic. These do not need to be refrigerated. If you were prescribed injectable medications, they will come in vials that look like this. Some of these medications will need to be refrigerated immediately after unboxing. You should check the plastic prescription bottle as well as the vial for directions prompting you to refrigerate. Most vials will have detailed recommendations for storage on the side of the vial. If the vial does not recommend cold storage, store the medication in a cool, dry place like a cabinet. If you have any questions about whether the medication needs to be refrigerated, please call our clinic. Some medications come in a powdered form that looks like this. These are called lyophilized medications, meaning they are frozen, then placed under a vacuum. Essentially, they are freeze-dried. Once these medications are reconstituted or mixed together, they will need to be refrigerated. See our video on reconstitution for how to mix these medications. There are two types of injections we may ask you to do at home when working with our clinic. The first is into the fat, also known as a subcutaneous injection. The second is into the muscle, also known as an intramuscular injection. Your provider and patient care advocate will tell you which type of injection to use for each medication. It can also be found on the plastic prescription bottle's label. We have videos on each type of injection to show you how to perform them. All needles will need to be disposed of properly into a sharps container. When you are done using a needle, put the needle directly into the sharps container. It is not recommended that you recap needles, as this increases risk for needle stick injuries. Used needles can transfer blood-borne illness, so it is extremely important to practice safe needle use and disposal, especially if someone else is helping you with your injection. Keep sharps containers out of the reach of children and pets. As always, if you have any questions throughout the unboxing or medication administration process, please feel free to contact our clinic or your patient care advocate. Thank you for trusting us with your health and wellness. We are excited to begin this journey to better your health.